All right. Good afternoon. Good morning from wherever you're coming from. There's people been asking about sound. Are we able to, can you hear me now? Now that we're on and live? Awesome. 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 Well, we've got people joining pretty quickly here this morning, and that's amazing. Happy Friday, everybody. The weekend is almost here and with us. And excited for you guys to join in. We'll typically like to give another minute or two to wait for people to log on before we jump in. We've got a great topic today. Great way to wrap up the week, learning about some amazing ways we can help each other, help our patients. While we're getting started here, in the chat, why don't, if you can, put in whether you're a clinician who works with patients, whether you're a patient or a home user of Ozone or other therapies, or both. Let's just kind of get a feel for who's joining us this morning. And then we're going to dive in here. Amazing. Good mix here. Some patients, all the above. Fantastic. Great. Love this. Love seeing all the users on here and all the clinicians. So I'm going to dive in and get started. As we go today, kind of the way I like to do these is if you have questions as we go, please put them in the chat. And at the end, one of the hosts here will help ask questions, and so we can get those. There's no way to get to all of them, but there are definitely ways we can answer questions. So let's rock and roll. We're past our time. So I am Dr. Ryan Meyers. I run the Movement Clinic, which is in Utah. And we specialize in accelerated healing and recovery therapies, everything from pain and sports healing to chronic illness and functional medicine, which is what we're talking about today. And this is a huge part of my practice, and what I see and work with literally with patients on a daily basis. And Ozone, amongst many other therapies, are things that I use myself, that I use for patients as part of treatment plans, and that I teach on and work on. So thank you so much for joining us. Today, we are tackling long COVID. Now, you see me putting that in quotes. We're going to talk about that, but long COVID, it's there. If you can believe it, we are coming up on 5 years of what I would call the COVID era, or even now, I believe we're probably in like a post-COVID era. But 5 years since COVID really hit. It's kind of crazy to think about that as I think about what that looked like, what we did with our kids in school, work, what grocery stores looked like. But we're 5 years in, and we're still dealing with health concerns that have come from this, which now is being dubbed as long COVID. And I put it in quotes because it's not really a diagnosis, but it's something that we talk about, this long COVID or COVID long haulers. We're going to talk about today. We're also going to talk about this thing called persistent spike protein syndrome. Get ready to deep dive. We are going to dive deep. So the lucky thing for everybody is this is recorded, so you can come back and rewatch it. You will be able to get it. But there's some interesting things, fascinating things here about why this whole syndrome and this situation of post-COVID is so challenging for the conventional world and all the worlds, but what we can do if we truly understand the mechanisms of what's happening. So let's dive in. Again, my name is Dr. Ryan Meyers. I work with the Movement Clinic. I also work heavily with hyperbarics and own US hyperbarics. And then we work with silent illnesses, and that's a way that we work with patients all across the country for functional medicine access. So let's dive in. So for today, as we talk about objectives, I really want to define this long COVID thing. at least from a basic standpoint of really all that what we know. We're going to talk about some underlying science. We're going to deep dive in this persistent spike protein syndrome because it is critical and one of the big keys of why there's misunderstanding of how to treat this and why some of these alternative and functional medicine therapies and treatments are really the keys to helping to unlock this and get people better. And again, we use these in our clinic every day, and I see patients get better every day. It's not quick, but when you do the right stack of things together, we see dramatic results. And then, of course, as always, we're going to review ozone therapy and how its mechanisms relate directly to what we're talking about today, because that's what's important. We know ozone works with so many things and is so safe, but really after we define and deep dive into long COVID and persistent spike protein syndrome, how does ozone directly address some of those issues? So first of all, what is long COVID? And the short answer, and really the answer, is you had COVID and now you still have symptoms. Days, weeks, months, years later. We can now say that. I think initially a lot of the thoughts were, hey, I've had this for a couple months. Why isn't it going away? I'll tell you, I visit with patients who have been sick for almost 5 years now, ever since they've had COVID, and it's triggered lots of things. And that's what we're going to talk about. And so really it's, you had it, you still have symptoms. They're multi-systemic. And some of the most common ones that people talk about are this chronic fatigue, neurocognitive brain fog. However, we're also seeing very specific organ dysfunctions and other things come up, and we're going to talk about that. If you've listened to any of my webinars before, you'll know I am so big in what I call patient speak. And there's so many home users on here. And so when I talk to a patient, I've got to be able to distill all this science down to something that's so simple that they can understand it, or else it doesn't matter. So the patient speak I use with things like long COVID is this simple analogy of the infection of COVID was like a hurricane that came through. So where we're at in this long COVID or COVID long haulers is the hurricane has come and went, but what's left behind is the wake of damage that it left. This torn up infrastructure, flooding, damage, all these different things. This is what's happening in our bodies. The hurricane has come and gone, but what's left over, and these pictures they're horrible of what's happened, but they're great depictions of what's going on inside of our body, of this multi-systemic inflammatory damage and wake of the hurricane that's causing our physiological systemic infrastructure damage that's causing us to not be able to heal, have other sicknesses and issues, and take so long to get through this. So I love this visual. So what are the core mechanisms or the biochemical or pathophysiological mechanisms of long COVID? And you can see the list here, viral persistence, but immune dysregulation. We have endothelial dysfunction and microclotting. We're going to talk about all these: mitochondrial dysfunction, neurological dysautonomia, gut dysbiosis. I highlighted all of those because if you notice, all of them have the prefix of dys, which means abnormal, difficult, impaired, bad, or ill. And I just loved this visual, and really going back to that visual, that really what is happening in a post-COVID or long COVID world is every system in our body can be left abnormal, difficult, impaired, bad, or ill. And so in so many different ways. And when you start to see that and think about that, you think, yeah, that makes sense. It does this. We know it does this because we're living it, we're seeing it, we're feeling it. We know we're living in this world on the right hand of the screen inside of our bodies. Everything is dys. Everything is abnormal. Everything is ill. Everything is impaired. And now it's causing systemic downstream effects that sometimes, like we learn about this in hurricanes and natural disasters. You get the disaster effects from right after, but there's also effects that can't be seen for days, weeks, months, or years that happen in those areas. And that's exactly what's going on in our body. So diving a little bit deeper. So really, what is this immune dysregulation? So really, it activates this chronic immune and inflammatory response. We're going to dive into that and can trigger autoimmunities. We're seeing a huge spike in autoimmunities post-COVID and from people who have been exposed to COVID because of what this does to us biochemically. We're very familiar and we read about in the news all the time about this endothelial, so cardiovascular microclotting issues that can impair blood flow, tissue oxygenation, but really can start causing clotting issues, which are a problem. And then mitochondrial dysfunction and energy deficits. So yes, we do talk about chronic fatigue and chronic fatigue syndrome, and those things we're going to talk about, but it's also on a cellular level. And this is one of the big things I'm huge on when we talk about mitochondria. It's not just, do I have enough energy to make it through the day, but do my cells have enough energy to influence the tissue function, to influence the organ function and system function? And that's a huge part of what's being downregulated and becomes dysfunctional. Neural inflammation and dysautonomia. So we're very familiar with the brain fog and autonomic balances. This neural inflammation cannot be downplayed enough. We're now starting to see some, big medical institutions actually recognize that this could be kicking off early or what's called mild cognitive decline, which is what can lead to things like Alzheimer's, dementia, but also other neurodegenerative illnesses. We're seeing that this is starting to cause some of those things. And then gut dysbiosis, changing our microbe, which then affects all the rest of it on the top of the list more severely and exacerbates that whole problem. And so again, it impairs every system in our body. It makes ill, broken, or dysfunctional. It can every system in our body. And we want to talk about how, and then how ozone can help us with that. So let's review persistent spike protein syndrome. This is something that has been written about a little bit out there. Some people are very familiar with it. I will tell you, I hear people ask about spike proteins all the time, but do they actually know what they are? And do they know why the persistence of them is really causing an issue? And then really understanding that is half the battle, but by understanding what this is, it helps us know what we need to do to treat and how to help these people get better. So what are spike proteins? Very simply, if I were to go back to that picture of COVID, there are these little proteins on the surface of the COVID molecule that are basically like keys that allow them to enter our cells and do their damage. Well, a lot of the COVID vaccines were triggering these spike proteins. And so what's the problem? Whether your immune system goes in and kills COVID on its own, or a vaccine went in to do this, whatever it is, what this syndrome is if there are still those fragments from those spike proteins, so the immune system, whatever went in to break up and kill this virus, there are still fragments left over of these spike proteins, and they lingered in the body and started to reside in tissue and cause problems. And the real highlighted here or bolded in italics is what that did is it caused this continuous stimulation of the immune system, because the immune system said, well, hey, there's still bad guys here, but there's also bad fragments on fire. It's almost, if you think about that COVID cell, we went and blew it up, but now all these little fragments that are on fire and just as inflammatory. And so your immune system stays turned on chronically to fight these. And here's a reference. We'll put this in the chat. It'll also be available to you through the recording of a great article on a website, Mediskill website, about this. But the reality is it's triggering the immune system to really stay functional, which for days, months, weeks, years. And so what are the mechanisms of that persistence? So this incomplete clearance of these spike proteins and these spike protein fragments is what's causing the problem, especially once they start to settle into our tissue reservoirs. One of the main places is within this vascular endothelium, so within the lining of our blood vessels. these fragments that are on fire and inflammatory start to reside and fall into these tissues, and then they start to cause other havoc. So we talked about this chronic immune activation, but it's also going to damage the tissue that it's residing in. It starts to cause clots and starts to cause other issues. But then this starts to trigger autoimmune responses and other issues. And we also get this thing called inflammatory gene activation. I told you guys at the beginning, buckle up because we're diving, but this is all good stuff. And so what I want to look at is we're going to next look at this inflammatory gene activation. What is this and what are its consequences? This is something that I, again, talking with patients, but working with other clinicians and seeing things that I read out there is talked about, but I think is misunderstood and needs to be clarified. So what is this? So what are inflammatory genes first and foremost? Well, they're genes that we have that are triggered and are supposed to work for a good thing to regulate the immune response by controlling the production of cytokines and other mediators of inflammation. So what does that mean? These are genes that we are coded with so that when we need to have an immune response, they go do their thing, but then they're supposed to come back and sit back at the base when they're not supposed to do their thing. This inflammatory gene activation from these spike proteins triggers these to turn on, and then I like to think of it as it breaks the switch to turn off. So now we're just producing these, and you can see these examples listed here. I'm not going to read through all of them, but again, the bolds, right? It triggers production of inflammatory cytokines, inflammatory and immune responses, systemic inflammation, amplification of inflammatory responses and inflammation. And so what happens is these very specific genes, which again, in acute small doses are positive, but become negative when they're triggered and turned on, and we don't know how to turn them off. And then we get this outpouring of uncontrolled, unbalanced, dysregulated inflammatory response that becomes systemic. And so what are common outcomes of this? Well, we get this chronic inflammation. So this persistent activation leads to ongoing low-grade inflammation. So what does that mean? So I'll talk to a lot of people that say, like, I kind of just feel sick all the time. Or I feel like every 4 to 6 weeks I get a cold again and then it goes. Or it's the, man, everybody in our house got a cold. They got better in a week. It took me 3 months to get better. This inflammation is just there. Or my joints always hurt. My brain doesn't work. It's because this inflammation is going on and it will not stop. Cytokine storms, best phrase for chronic inflammation, because if you picture that you have a storm of inflammation inside your body, that hurricane, we can get these systemic immune reactions. And this is why people will get weird things. They'll get cysts, they'll get gut issues, they'll get a clot, they'll get a brain thing, they'll get growth, they'll get different symptoms that don't always seem to be connected. Neuropathic pain is on this list. They don't seem to be connected because we can't, if you're looking at it at the surface, like, man, all these things are over here. If you look at them as, man, we've got a ongoing cytokine storm that's been triggered from these immune genes or inflammatory genes by these persistent spike protein fragments. Now you understand, okay, it's all connected, even if on the surface it doesn't look like it. Tissue damage, so people not being able to heal as fast, getting injured more, or starting to see connective tissue breakdown. We've talked about autoimmune disorders and we're going to bring them up again, but these inflammatory gene activation can trigger or can upregulate or exacerbate either benign autoimmunities, can bring on ones that people have never had before, or if they currently have one, it can make them worse. Metabolic and vascular dysfunction we've talked about, but this can cause hypometabolism, insulin resistance, cardiovascular complications. I see a lot of people who say, I used to be really shape and work in and out and be able to go to the gym or run marathons or do all the things. But ever since COVID, they're like, man, I walk up the stairs and I'm out of breath. This exercise intolerance is being driven dramatically through this. And then overall pain and fatigue. I don't think chronic fatigue syndrome is a diagnosis, it's a symptom, but it's being diagnosed all over the place. So whenever I hear that, that's a big trigger for me that there's been some type of viral exposure that has caused this cascade to happen. But again, we're seeing a rise in arthritides, fibromyalgias, and these are all diagnoses, but are really symptoms of what's going on underneath the surface. The other thing that with this is I want to touch on what are called HLAs, which are human leukocyte antigens. We've heard about these a lot. They're proteins that are essential and part of how our immune system functions. There's hundreds, if not thousands, of HLAs that can be associated with lots of things. Now, one big misconception is these are not necessarily or not typically classified as inflammatory genes, because they work in as how the immune system should work, not cytokine or inflammation production. However, they work in the inflammatory process. And so when these genes are activated, they can kind of turn on or up-regulate the expression of these HLAs. So what does that mean? If you have an HLA that's associated with rheumatoid arthritis or some type of autoimmunity, but you're living a really healthy life, you probably have no symptoms whatsoever. In comes COVID, messes everything up. This persistent spike protein thing happens, turns on inflammatory genes, and now all of a sudden you're months later and you're getting symptoms of RA. You're getting immune symptoms. You're getting SIRS or biotoxin illness symptoms, because the inflammatory genes are basically coming and knocking on the HLA's doors and saying, hey, we're here, we're not going away, wake up and start working and start causing havoc throughout the system. And so what it just helps pump the inflammation, but also gives the inflammation a pathway to cause very specific, especially with autoimmunity type reactions, if not others that weren't there before because those doors weren't open. And so we talked about this, but these HLAs have strong associations and are with autoimmunities. And these are things that we're seeing huge spikes of since in this 5-year window of COVID. RA, so rheumatoid arthritis, type 1 diabetes, MS, huge, huge, huge. But this is again why when someone comes to me with MS, I'm going to say, okay, but what's going on underneath the surface? What biochemical things are happening? What physiological disruption is going on that led you to that? And we got to help heal and fix those. And when you understand this process of how this persistent spike protein kicks off inflammatory genes, which then trigger these HLAs to upregulate, you can know that we can use tools like Ozone, hyperbarics, and others to reverse that process to heal. SIRS is a big one. Chronic inflammatory response syndrome. I work with this very deeply and heavily in my clinic and with our patients. It's response to biotoxins such as mold, Lyme, etc. But there are HLAs that are associated with this diagnostically. And so when they have those and have no symptoms, but now get COVID and this whole downstream effect happens, now we're getting chronic inflammation and systemic symptoms. So overall, right, what are symptoms that we see, or these are what people come to the clinic with, or this is what people talk about, or this is what you're going to the IV bar, IV spa for, or this is what you bought an ozone machine for, is because you want something to help get rid of your chronic fatigue, your joint pain. You want to help something to fix your brain fog and make it so that you can actually think or function. You know, you want to figure out how to make this cardiovascular stuff that you've never had in your life go away, or you're dealing with rashes or gut issues or whatever. It's we tackle these symptoms, or we go seek out therapies, supplements, treatments, etc. for my fatigue, for my gut, for my this. Even that inside this functional alternative medicine world are band-aids if we don't know how to identify and understand the root cause of what can happen in long COVID, so that we can use these therapies to be very targeted to help make this and get us there. I bolded symptoms, and I think the reason why is because, well, I know the reason why is because too many of these things are coming as diagnoses. A colleague of mine shared with me a link that this local huge medical institution put out this, what they called a landmark study, that they officially know now that we have large spikes of chronic fatigue syndrome secondary to COVID. And I was just, and the thought was, okay, so we have people that are experiencing abnormal amounts of fatigue secondary to viral exposure, and we give that a name instead of saying, okay, but why and how do we treat it? Fatigue is a symptom, it's not a diagnosis. In my clinic, we call those name badges, that people come in with name badges that they've been given that say, oh, you've got fatigue syndrome, you've got this, you've got this. These name badges have to be ripped off because that's not how we identify what's going on. We don't identify their illness. We find root causes and fix, heal, and change. So actual conditions again that we're seeing. So SIRS is a legit syndrome that has diagnostic criteria that I am seeing triggered by long COVID left and right all day long. Mast cell activation syndrome, so skin related conditions. We talked about chronic fatigue. We've talked about autoimmune, these neurological and cognitive disorders, everything from brain fog to mild cognitive impairment and mild cognitive decline. And cardiovascular, I think, has probably been one of the biggest ones that we see in the news because of how it's affecting high profile individuals, especially athletes. We're seeing cardiovascular stuff come out of the woodwork here in this post-COVID era. So why is this hard? Why is the conventional world struggling with this? And it comes down to what we've talked about, but really a lack of unified framework and reliance on symptom management. There's not really a way to diagnose and in the conventional world and say, oh, yep, you have long COVID. It's basically you've been sick ever since you had COVID, so you probably have this. And so then we're going to look at these as symptoms and say, well, let's give you something to help with your fatigue. Let's give you something to help with your headaches. Let's give you something to help with your joint pain. When reality is what we should be doing is looking under the surface and measuring and calculating what these inflammatory markers are. There's biological markers that we use that measure immune response, which helps us to know and measure this out of balance and this dysregulation so that we know how to go about and take care of it. I think the other hard part is in this world now, because of how the medical community is set up, we have this fragmented approach. So someone's starting to get endocrinology type symptoms, so RA, et cetera, they're going to see their endocrinologist. They're also seeing a neurologist. They're also seeing their private practitioner. So now they're seeing multiple that are all doing in their specialty, but nobody's coming together to address the root cause. This is one of the things my clinic really focuses on. But this is how at home and the clinics that we're using, we can leverage things like ozone, hyperbarics, and some other treatments to really, really, really make a tremendous difference. So enter an ozone. This I found, I had this thought, but yeah, enter an ozone. Here we go. So how can ozone help us with this and help solve these problems for us? And it's like, bam, here comes ozone, and how can we use it? So quick overview, but why consider these types of treatments? It's because to really, really, really get after this, we have to have a multifaceted approach. There's not one fix all. As much as I love ozone, it's not a fix all, but it works so well with our patients. And when we stack into a multifaceted approach, leveraging something like ozone, I tell my patients when I use ozone, and I often stack it with hyperbaric oxygen therapy, that together they are the best firefighters, but they're also the best disaster cleanup and repair to help rebuild the system. And ozone does this. It does this whether you're doing it at home. It does this whether you're doing it in a clinic. It addresses the underlying causes of mitochondrial dysfunction. It addresses detox imbalances. It addresses the immune modulation and really does a lot of those things better than anything else out there. And so really what's the goal when we're looking to treat? We have to reduce this gene activation. We have to turn these genes off. And then we have to, that's why I say put the fire out. And then we have to rebuild, repair, and make sure that the system can function the way that's supposed to. And ozone is such an amazing molecule and tool to do that. So quick review, most of you here are ozone users, so you know a lot of this stuff. But what is ozone therapy? What is ozone? Well, it's a very simple molecule. We take oxygen, we bust it up, we bring it back together again, but as O3. So we have an extra molecule on here, or an extra electron, which makes it highly reactive. And it has antimicrobial properties. So it does work very well against viruses, which is very hard, but bacteria, fungus, etc. And it does a lot of things. It helps break down biofilms. It helps increase oxygen delivery. It stimulates the immune system. It addresses all of the things that we've talked about already. What are some of the major applications? And again, there's some links and references on a few of these, and there's more. MediSkill, if you're not familiar, is a phenomenal resource with tons of articles. There's protocols for home use that you can look at there. But IV, which is what we most commonly use, ozone IV, which we call major autohemotherapy or MAH. This is the most systemic that we see out there. And it's done through different dosages and frequencies, but it's the most systemic with the best support and is extremely, extremely safe. Most people, if you're using an ozone at home, are doing some form of rectal insufflation. And this is amazing. It's amazing for a gut biome, but is also a systemic therapy. There's other ways of insufflation. You can do nasal or sinus or ear insufflation. This helps. We use it a lot for those upper respiratory symptoms, but also neurological support. And then ozone is an amazing wound healer. So limb bagging, topical applications. I'll tell you, in our home, the ozone oils go super, super quick on bug bites, cuts, scrapes, scars, etc. There's also amazing tools like capsules. I'll tell you, ozone capsules are a dead giveaway if you're traveling, especially outside of the country. There's waters, ozone injections, etc. The applications of ozones are broad, but it's because this molecule can be used in so many ways. And so key mechanisms. So touching on this, we do help improve oxygen utilization through helping the mitochondria. We improve circulatory support. So we actually help to heal the blood system or our cardiovascular system, which we talked about as a huge issue with. By the way, all of these are things that persistent spike protein syndrome and long COVID cause problems with that we help heal. I love the term modulate or balance the immune system because too often we say, oh, this is an immune enhancing therapy. Well, if I already have an overactive immune system, do I want to enhance it more? No. Do we want an immune down regulating? Well, not if I'm already low. So one of the unique things about ozone is whether you're overactive in your immune system or underactive, it modulates back to the sweet spot in the middle and helps you to be balanced there. This oxidative preconditioning so helps your bodies boost their natural antioxidant defenses. We talked about antimicrobial. How many times have you gotten a flu or a virus and it's like, yeah, go home, it'll be gone in about 11 days. Well, what if you can act quicker to actually kill a virus, and ozone helps with that. And then detox. We talked about how these spike protein fragments settle into tissue reservoirs and stay there. We have to get them out. Not only do we have to get them out of the tissue, but then we have to get them out of the body. And that's where ozone helps pull those out and enhances our liver detox pathways to get them out of our body. So how does this all play into persistent spike protein? We've kind of been talking about this from the beginning, but it does reduce the gene activation. It helps to turn off those genes where they've been turned on, the switch has been broken, and now we're just pumping inflammation. This actually helps to reduce that activation and turn the switch off. It ups our body's natural defenses and it supports detox. So we're fighting the fire, and then we're rebuilding from the inside out and getting it out of our body. Overall, we're able to help mitigate this chronic inflammatory storm. We're going to help heal, and overall, you're going to feel better because we're addressing the mechanisms, not just temporally and superficially addressing symptoms. So how is ozone official with or beneficial to the actual conditions associated? Um, and again, we're talking about a lot of this, and some of it's repetitive, but I think it's good because we've got to understand that this tool works to help fix or help regulate the things that get dysregulated and is completely underutilized. So we lower the oxidative stress with ozone that's causing the tissue damage. We're enhancing mitochondrial function. This is something that's so hard to measure. I should have put a link in here. There's a great tool out there that I'm starting to use with my patients in clinic called Theriome. We can put this in the chat, and a link in the recording. But Theriome is a phenomenal tool right now that's come out, which is able to actually test mitochondrial function. There's a few other things out there that are really good that can do this, because we talk about having mitochondrial dysfunction all the time, but it's very hard to measure, and Theriome's doing some amazing things to help measure that. This neuroinflammation cannot be ignored. The number of people I've talked to since getting COVID that say, man, my brain just doesn't work. I don't have, I can't think anymore. I can't problem solve anymore. And unfortunately, the number of people who have started to have memory impairment and things like that since this, ozone can help reduce that neuroinflammation, balance that, and it has actually helped to repair the tissue that's damaged from neuroinflammation. And of course, we improve circulation and heal the damaged tissue from what's being caused there. Cardiovascular benefits. So again, these palpations, this dysautonomia that we're seeing, as well as reducing microclot formation. I mean, that's life-saving. If we can naturally help to reduce clot formation, you're saving lives. Regulating the metabolism, again, this hypometabolism, this weight gain, this insulin resistance that's starting to cause other issues and other health issues. And then again, modulating. I love that term of balancing and modulating the immune system, and then really helps to clear those persistent fragments that are causing the problem anyway. So ozone does actually help go in and grab these persistent spike protein fragments and can help get them out of the body. As far as we talked about this, we're shutting down the chronic inflammatory pathways. Again, deep dive today. I want you to have all this information, which is why you get this amazing recording. But it also helps to, what we see is calm down autoimmunity. Now, as many of you know, if you have antibodies for an autoimmunity, by definition, it's there. But in our clinic, we call it, can we get that autoimmunity to be benign? Meaning, can we put it in the closet where it stays there? And then can you live a life and utilize treatments and therapies and supplements and lifestyle habits to keep the autoimmunity in the closet? And ozone is how we do this, stacked with several other things. But ozone is such a key ingredient to how we can help do this. And then, which leads to that holistic approach of, we've got to have this multifaceted approach that's looking at underlying causes, that's understanding what's going on biochemically, and then introducing tools like ozone, hyperbarics, etc., to have a comprehensive strategy instead of just a medication for a symptom. So you've probably, I've used the term and I use it all the time. I call it stacking therapies, and where I see so much value and so much ability to create or increase the efficiency and efficacy of a patient's treatment when we can stack therapies on each other, both in a treatment plan, same day or at same time of treatment. And there's a lot here. I'm not going to read all through it, but I've talked about hyperbaric oxygen therapy. These are all oxidative therapies that are amazing, that work so well with ozone. And when we stack them, so do them on the same day, same week, etc., we see dramatic benefits, especially with consistency. High dose vitamin C, we're talking 50 to 75 grams or more. We're seeing dramatic support and healing. Methylene blue is a fascinating one that's out there. There's lots of good resources tied with photos. So really tied with red light is what that means. Photobiomodulation activates the methylene blue molecule to enhance mitochondrial function. There's lots of great targeted supplements out there. NAD, CoQ10, glutathione, consult with a professional. These are all things that we work with and use with our patients, very individualized to know how to help them with what they're doing. And I cannot over exaggerate or overemphasize detox therapies combined with ozone, and we could have a whole weekend on that, but detox therapies are dramatic for getting all of this out as we're healing and rebuilding. So key takeaways for today: long COVID is a syndrome. It's not an infection. This is not a condition of infection. The infection hurricane has come and gone. We're left with the wake of damage. Persistent spike protein syndrome is part of that wake of damage, but that is also one of the root cause key drivers of chronic inflammation and immune dysregulation that's driving now all these symptoms, syndromes, diagnoses that leave us with a fragmented medical community without tools like ozone stacked and diagnosed with the right frequency and dosage to target the actual underlying causes, is how we can integrate and use ozone on a daily, weekly basis to help improve not only symptoms, but actually heal, shut down the chronic inflammatory storm, and get our body returned back to some form of homeostasis. There's references that we'll share. Here's my contact information. Thank you so much for attending today. I'm gonna come over here and look at the Q&A. So we've got a few minutes left here to dive into some questions. But thank you so much for tuning in. I'm happy to answer questions. If you have more information, please reach out to me personally. Happy to point you to a number of different ways of how we can teach you guys how to use this, how we can help you do this, and how we can make a huge difference in your lives as a user and as a patient. So if you're looking for specific clinical protocols, so MediSchool has some on their clinic or on their website, but also we do trainings. We do trainings in person and through the website. There are courses that you can take where we dive deeper into those. I typically don't give out protocols on these sites because they're so individualized for patients. And I find cookie cutter therapy or treatment plans don't always work for everybody. So great questions there. I'm going to, let's see. There's also some Q&A, so I'm going to let's see here. So I'm just going to see if there's any good other questions that we can answer here today. So lots of good questions about how to stack or use these for specific conditions or specific people. Please reach out. That's a great way to look, because sometimes knowing more history about what's going on. Can you give IV vitamin C same day as ozone? I would say it depends on the patient, and this is where I'm going to be very clinically specific. I like to start everything with ozone and then so if we're doing ozone and a Meyers or ozone with some other therapy, I like to do the ozone first and then do that. And let's see, you can definitely, people ask questions about stacking ozone with methylene. So somebody asked about ozone and biofilms. Look to last week's webinar. It's out there. It's on. We can send you the recording for that. And there's amazing things that ozone does for biofilm, but we did that a couple weeks ago or last week. And okay. And if people are dealing with things like SIRS or upregulated HLAs based on that, their ozone is totally beneficial. If you're a home user, you can use that rectally through insufflation. You can get to doing where you can do IV, that is phenomenal. And acute with things like high levels after the flu, 100%. So we talk a lot about using ozone as part of treating chronic conditions, but I will tell you it's also amazing for acute conditions. So you just get a cold, do some ozone. I think for jet lag or if you're about to travel, ozone is phenomenal for that as well. So with that, everybody, if you have questions, again, you can reach out to me if you're looking for specific help with a condition or with help. We also teach and do certifications through MediSkill, and those are in person, and there's some online basic courses that we can help get you to where you need to get. So thank you so much. We have another one coming up where we'll be talking about mitochondrial dysfunction. So stay tuned to the emails and stay in touch. And yes, we will get this recording out to you. And let's go from there. Have a great weekend, everybody. Talk to you soon.